Can I have one of those? Fantastic. So it's the second time we're here at MEDICA, and we are really thrilled to be back. We had a great success story last year, and we're going to continue showing you more innovative apps. And before we start, let me just give you a quick idea of who we are here at Appcircus. We want to build a better world with apps. That's a big claim. We think of apps as solutions for real-life problems, not as gimmicks. And I think today we're going to have a nice proof of that. What we do at Appcircus is we have two streams. We do events. We have a global network of events, over 100 in more than 30 countries since 3 years. We are basically present everywhere, and we are mapping the ecosystem, so to speak. And then we do challenges, where we help developers to create better apps. Because if you want to solve a real user problem, you need to understand the problem well. And maybe I can talk about that a little later. First, I want to introduce the jury. We've got Tom Mitchell in the back there, president of the Messe Düsseldorf North America. We've got Mark Wachter, right here from MVC Mobi. We've got Frederic Jordax Marquez from Doctoralia, who is actually the winner of last year's Appcircus at MEDICA. Great success stories. I think they're now at 9 million users per month or something. Crazy. So this is what can happen. And we have Klaus Juffenbruch from Cisco. He was heading the strategy in healthcare at Cisco. And last but not least, we have Rob Mesereau from CTIA, who is the vice president at CTIA. So, with any further ado, first app to pitch. Please come up stage. ICANN.
ICANN Mobile is a DICOM viewer for all kinds of medical images. So the use cases are sharing the images in the hospital with the doctors or patient's bedside. Our app is bulletproof for the German Datenschutz. The German Datenschutz is the highest level that you can ever expect.
Thank you very much.
Thank you very much.
Well done. So next one up is iSignIt.
We developed an application called iSignIt to facilitate the interaction between the sign language users and medical staff. So iSignIt is actually a phrase book with 800 phrases.
How do they pay for this app? Or?
No, we developed those apps for free.
Thank you very much.
Thanks.
Great, well done. Next one, Lebak.
Well, good afternoon, everybody. Thank you for inviting me. I'm going to present to you the Debug app, which is kind of a basic app for all kinds of medical departments. That's going to be used more and more at the patient side, and those are tablet PCs, for example, and they get touched frequently. They're touchpads.
Is this live already?
Yes, it's
so
on.
Can you share numbers of downloads? Or?
We have more than 1,000 downloads for about 50 countries, and actually it was recently assigned being the weekly medical app in Australia.
Hey, on we go with social diabetes.
Thanks. This is social diabetes with a big D. There are, as you probably know by now, about 400 million people. That's 17% of the world's population. So what you can do is you can configure this for you, which you need to do if you have diabetes. You can set up your treatment plan that your doctor gives you. Thank you. Get a QR.
Good. So I guess we don't have to ask you about monetization then. This sounds like, is it a free app?
It's a free app, and it's also, there's a premium version as well. So the free app is for anybody to use on any of the systems. It has all of the functionality.
Thanks a lot. Great job. Well done. Okay, next one up. ASA Laser. Fantastic.
Okay, good afternoon, ladies and gentlemen. Good afternoon, jury. We have 3 different sections. The first one is anatomy, where you can see all the main body districts with the 3D animated video. The second one is pathologies. Basically, for each body district, you can select the main pathologies to see the effect and to recognize also the scientific information. The last one is 3D treatment. For each pathologist, you can see with 3D video how to treat with the laser this pathology. This is our app. This is as a laser. Even less.
So can you imagine to roll this out to other laser providers?
Yes, I think all our competitors download this app because it's completely free. But,
Fantastic. We move on with lab tests online, please.
Thank you. It's a pleasure to be here at Appcircus at MEDICA, talk to you about Lab Tests Online M, an app that we believe really does put health literacy in the palm of your hands. Unfortunately, patients are not very well aware of that role and what it means when the doctor runs a test. And that becomes a barrier to the communication and the engagement of the patient in their care.
So is this a kind of encyclopedia for lab tests or a sort of a Wikipedia?
Definitely not Wikipedia. This is the information here has been vetted by laboratory professionals, the people who are doing the tests.
Thanks a lot. Well done, Matthew. App telemonitoring system, please come to the stage.
More than 50% of the European cost is destined to the chronic and elder people. And we have to reduce that. Primum Health have made a home care telemonitoring system, having the same care level for the patient, improve the quality of life, and reducing the time to come back to the hospital.
All the interface devices I saw up there were Android-based. Is this also available in iOS?
No, because we offer as a cloud system.
Clock Pill, please come up the stage.
Hello, I'm here to present you Clock Pill, a simple and beautifully designed medication management system for everyone. Clock Pill allows anyone to organize their medication, be notified of every take, report adverse effects to competent authorities, know more about the medications they are taking, and many more features. Finally, we aim at closing the gap between patients, their families, and institutions. So this is Itrar presenting your Clock Pill. Thanks for listening.
Well done. Thank you very much. Okay, next one up, Neomed.
Hello everyone, my name is Antonio and I work for Neomed. So for those of you who don't know what Neomed is a social network for doctors in Spain. We launched 2 years ago and the purpose of the network was to connect doctors within the same specialty or other specialties, share knowledge, and basically expand the knowledge on other areas.
So you make them addictive by this crowdsource thing, and then afterwards you sell them.
I don't think it's addictive. I think it basically says that the doctors have questions, but you actually pull them in. Yeah. It's a pull strategy. Yeah, absolutely.
Yeah. Okay, last but not least, Help Talk. Thanks for holding up.
Good afternoon. I'm here today to talk about Help Talk. My name is Leandro Poza. The idea came from a conversation we had with one of our team members who is a nurse at the intensive care unit of our local hospital. And she was explaining to us how difficult it was to communicate with ventilated patients. She was telling us that they were conducting a study to improve this communication. And the study was, they showed the patients that were trying to communicate a chart with symbols and asked them to point at the symbols. We immediately realized that we could do a lot more for the patients with a mobile app. We could actually have an app that would speak for the user. Thank you for your time. Any questions?
So last question, how many users do you currently have?
At the moment, we have more than 5,000 downloads, and we have more than 25 profiles in 12 different languages, and these are public profiles because there are hundreds of private profiles. Most people don't want to share the profile they create for themselves.
Thank you very much.
Thank you.
Fantastic. Wow, a big thank you to our app makers. This was a great show. Thrilled. Good luck, jury. That's all I can say, really, because now it's up to you guys to actually say who will win. I give you 5 to 10 minutes.
Okay, we have a lineup. We decided to, although we only have one, let's say, real prize, of course, we also have the prize of being famous. Yeah, so whoever was here on this booth today already on this pavilion, so all the 10 participating apps, I think a warm applause that you did it so far. Yeah. So place number 3 goes to a nice town in southern Germany, Würzburg. So I can come up. Number 2 goes to somebody who wants to talk about help. So Help Talk, come up. Congratulations. Yeah. Thanks for being here. Well, and then the final, the winner of the Appcircus at MEDICA here in Düsseldorf, of the second Appcircus we did, yeah, is I Sign It. Come up. Come on stage. So, yeah, you can't believe it?
No, not really.
These are the magic moments where somebody really don't know what to say.
Yeah, thank you very much. This is amazing. Actually, this will support our idea because we plan to involve other countries as well.